Goodman on the line.
Hello.
Yes, Tony, can you hear us?
Good morning.
Good morning. Thank you for your time with us.
A pleasure, my brother.
All right, well, let's take these things one by one, okay, and get some clarity. So you've just heard the senior project manager. He says that the health ministry has all the data. In fact, Lightwave has been kicked out of the system, so they can't possibly be the ones switching it on and off.
Good morning to our listeners. The truth is that we won't, as an institution, put out falsehood. We won't put out untruth stories just to make any point. What we have said is the truth. What we have put out there is what we have endured for the 6-7 months or so. And even yesterday, again, we met the technical team in the ministry to ask them whether we have access to this server. They said no. We asked whether we have data that were collected during the project. They said no. When we met Eric, who just spoke, and his boss in the ministry, we asked all these questions. They said they were not going to give us any access. And that what we are requesting for is their intellectual property. I said no. In the contract, it's stated clearly that at every milestone, you are supposed to hand over the logistics you procured, the service, and the server, including data, to the ministry. You have not done that. They said no, they are not going to do that because it's part of
Tony,
what they are doing.
Yeah, let's clarify. What are they referring to as their intellectual property? Is it the data or the software that they created?
It's supposed to be the software. In the contract, it's supposed to be the software.
They say
the data
that
the document belongs to the ministry. That is what we were requesting for.
Right. They say that the software that they created, it is not supposed to be the property of the government of Ghana. That the contract they signed was not for the software. That they were only supposed to give government of Ghana license to use the software. Is that correct?
That is not correct. That is not correct. I'm sure they have not read the contract very well. They are supposed to provide a service for the people of this country. This includes logistics, creating a platform for us to run our health data on. And then after it, and if we think that we want to give them service maintenance contract, they can maintain the product, but the whole thing belongs to. How would you be paying $100 million for a contract and say that the thing does not belong to the government? So what were we paying for?
According to them, you paid for the hardware, all the servers they provided, the data and the connectivity that they provided, but the software itself, you only pay for licenses to use it. And in fact, you were given a universal license, which means you can use it in every single site, as many sites as you want. But it's a license, not ownership of the software.
No, that is also not correct. The project was for 950 facilities they connect and allow us to use. So the first phase was to provide for some facility and hand over. The second phase was to buy some logistics, connect and hand over. They are all in the contract. These are all in the contract. I'm sure they are misreading or are not actually placing the contract in proper perspective.
Okay.
He also mentioned that we were trying to. They have not met the minister. He hasn't, but the directors of the company have met the minister on 2 occasions. The third one, he was part of that meeting in the Ministry of Health. So it is not true that we met them only on the 3rd of September.
Now,
he also mentioned that we owe them some amount of money.
We'll come to the money in a minute.
But Tony,
yes,
on the license. So let's get a clarification here.
Okay.
Is it in the agreement? So let's get to the contract that we signed. In the contract, is it clearly specified all the things you're telling us, or the assumption is they should know?
It is an assumption. It is never an assumption. It was based on that we wrote to them that the contract has come to an end. The milestones you are supposed to deliver, you have not delivered them. Can you please deliver whilst we continue this agreement?
Okay, so let me just get this clarification.
In the contract.
Okay, so these are things specified in the contract.
That's correct.
Okay, go ahead.
All right. Now, let's talk about the money. According to the minister, they've done less than half of the project, but they've been paid 3/4 of the money. They say it's actually the opposite, that they've done more than 3/4 of the project, because the 450 that they've done are the big hospitals and institutions. The 500 that are left are the small ones. So in essence, they've done more than 3/4 of the project. What do you say to that?
Kojo, you see, we should be charging them for a contract we're supposed to run for 3 years, has now been given a 5-year period because it's been extended twice. The contract was supposed to end in 2022. They've extended it to 2023 and again extended it to 2024. So who is losing money? Is it not the people of this country that is actually losing money? Because if you end the contract, there will be some value for money. But here is the case: we have extended twice. You've told us that you are going to do this thing for this period. We signed the contract. We are going to pay you this amount of money, and you have dragged on. Who is losing money? Is the people of this country. Now let's come to the cost. I hear them say that the project in a teaching hospital is bigger, and for that, all of that were calculated as part of the contract. Nobody will tell the ministry that he knows the teaching hospital or the facilities properly than us. We know that in a teaching hospital, you have various facilities making up the teaching hospital. So we quantify that and then give you the contract. So if you come and tell us that you've done more, no, you have not done more. You have done 77% of the work. We've given you 77. You've done about 45% of the work. That is also correct.
Wait, Mr. Goodman, again, let's clarify.
The amount is 100 million. We are giving 77 million.
Mr. Goodman, let's clarify one more time. Okay. You are saying that the contract provides for the different weighting of the hospitals based on the size, right?
That's correct.
Which means that if you do one teaching hospital, it's equivalent to doing several, maybe even more than 100 of the small healthcare centers. Is that correct?
That is not correct. Not up to 100, but some amount, because in a teaching hospital, you would have various hospitals in the teaching hospital. Say you have a medical department, you have surgical department. You quantify them as one.
Yeah.
But the total in one hospital.
Yeah. So let me ask you, Kolebu's staff strength is what? Several hundred, am I right?
Yes, that's correct.
Maybe about 700 or 800 people. Is that correct?
Yes.
Okay. Which means that you would have to provide laptops, computers for all of these staff to be able to access the system, right?
Yes.
Okay. But there are healthcare centers in Ghana with staff strength of about 8. Hundreds of them. 8 people.
Yes.
So would it be incorrect for them to say that if you take one teaching hospital like Kolebu, it's equivalent to over 100 of such healthcare centers?
Kojo, the contract contemplated all of this. We knew.
Okay.
That
so
you must start
with that
from
in
the bigger
mind,
facility.
So with that in mind, would it be correct to say that the 450 hospitals they have done constitutes less than half of the project?
Yes, in percentage wise, that is what we have quantified after the assessment, because most of the places they indicated that they have connected. After the assessment, we realized that we're not connected. When you deduct the logistics, which they said they have provided but have not provided, this is where we come to the realization that it is less than half.
But you say that these 450 are connected.
Yes, they are connected.
So these 450 that are connected.
Documentation they gave us, they said they have connected 481. But after our assessment, we realized that it's 450.
Let's stick to the 450.
No.
What percentage of the project does the 450 constitute?
For us, what we have quantified is less than half of the total project.
Even though it includes all the teaching hospitals and the district hospitals?
Yes,
And the
because
regional hospitals?
the contract is not only looking at connectivity. The contract is looking at the host of items, a host of services to be provided. So it is not only connectivity. There are other things that have not been done, and if you quantify them, that is where you come to. We are not looking at only connectivity. We are looking at providing logistics. We are looking at providing some earth we are looking at providing service. If you've not done that, and we quantify all of that, this is where we come to. Not just the connectivity. Let's put that on record.
Okay. So this is all as a result of an audit that you did, right? All this information that you are basing.
That's correct.
Okay. Who did the audit?
A team was actually constituted to do this. They went around the facility that were given where Lightwave indicated that they have actually worked in. They went there. There is another team also that went around the facility to verify whether the audit was actually going on. So all of these things were done by the ministry.
Where from this team? Is it a private company?
Yes, it's a private company.
A competitor of Lightwaves?
That we don't know who is a competitor. We don't work in Lightwave to know who is their competitor.
But
For
it was
us,
a
work
private
in the ministry, and we want
so it was
the
a
best
private
for the people of
IT
this country,
so
and
it was
then we have gotten that.
It was a private IT company, correct?
There was a company that did that.
And it was a private IT company?
Yes, that's correct.
So how do you have an IT company audit another IT company?
Yes, because it's an IT related work. You cannot have any other institution doing that than an IT company.
This was an
Those
audit.
who understand the field.
This is an audit. Why not have an auditing company do it?
No. You may choose whichever what you have inherited. If you inherit something, you look for which institution will best serve your need. Not just sit and then assume that this institution will be able to do it or that will be. You pick up your what do we call your environment. Look at the environment. What do I need? What is there? What do I want to unravel? And then look for a particular, because in even IT they do IT audits. So it depends on how you put this, Kojo.
Okay. So did you give a copy of that, or did you give a copy of this audit report to Lightwave for their response?
No.
Okay. Is there a reason for that?
Because we're struggling to get Lightwave. We're struggling to get them to a meeting. We're struggling to have some cordial communication. So that is how come they've not been able to get the report.
What about the meeting in September? Did you give them a copy of the report then for their response?
No. The meeting did not end well, as expected. We had a meeting. They wanted a particular. They made some demands, and were not able to hit to their demand, so it was inconclusive.
Well, Blessed here. So, two things I want to find out from you. First off, the concern about what's happening in our hospitals, because I recall speaking to the health minister where he says there'll be a phased out or rollout of this new GHIMS system that you're bringing to replace that of Lightwave. Before we touch on that, just a bit on the contract itself. So you have some 500 more facilities outstanding, correct?
That's correct.
Will you open this up to competitive bidding, just in case Lightwave is interested in coming back into the fray and applying, just to network all these 500 facilities?
So the 450 which has tested or have tested the Lightwave system, we are working to place them back on the Ghana Health Information Management System, which is the GHIMS. The rest of the 500, and the Honorable Minister has announced that is going to be open to competitive bidding. So that is the procedure.
Yeah, my question to you is...
whether if Lightwave comes, that I will not be able to conjure because it goes through a competitive tendering process They have to appear before the team and all that. So that will be done at that level.
Do you have the permission?
Unable to predict the future.
Do you have the permission now to roll on the 450 that you claim belongs to Lightwave onto this new Ghana Health Information Management System?
Yes, under emergency, we are as you maybe our hospitals are down, and we have to, as a matter of urgency, do this. So that one we started since yesterday.
But you haven't. You haven't paid.
Activate all of them onto the new system.
But you haven't paid for all of this, have you?
I won't be able to know that.
Because the minister talks of an invoice that's before him, but he says, well, payments must be justified, he says.
Yes, with the Lightwave payment, which you are talking about, the contract came to an end in 2024, and then we have invoice coming up after the expiration of the contract. How do you honor such? Unless you extend the contract, you won't be able to pay. Unless there is a valid contract, you won't be able to pay. So that is why he's saying that he's finding it difficult to deal with the invoice.
So does that mean that the ministry has to extend the contract and then pay them?
No.
Why not?
That discussion will have to be done by the company and then the ministry. That is where we've been expecting them to do. That is how we expect this whole thing to go until the company decides to shut our system down, until the company decides to put Ghanaians in this traumatizing situation, and we have to take a bold decision in making sure that when we go to hospital, the system we want to see run.
All right, I'm going to bring in Kwame Sarpong Asiedu in just a moment to have his take on this. But just one more thing on the new contract or the new project, the system that is being implemented. The health minister said in the press conference that it's going to cost us half of what we spent on Lightwave. So that's $50 million.
Yes, the minister said it will be less than half of what we are spending.
So around $50 million. Okay.
He said it will be around that.
Okay.
He wasn't sure of the figure.
And he says that will be a saving. But in order for Lightwave to finish it, it would only cost us some $25 million. That's what is left on the $100 million contract. So we are actually spending more on the new one, aren't we?
No, we are not. We are not. We have actually lost because the contract has been extended twice. So we've actually lost some money.
But the amount hasn't changed.
Yes, but the timing is of essence. In contract, timing is important in contract. I have a period and I want to see this materialize. If it doesn't, you have lost money. So the facilities in the various areas where we don't have Lightwave, whatever is happening currently, we don't know. We know that it was to provide some proper billing. Other facilities where we don't have Lightwave, if we are losing money today, it's to the loss of the state. So we're actually losing money as a state.
But it's still 50 million we're going to spend compared to 25 million we have left on the old one.
The minister said it won't be even up to half of the amount. He didn't mention a figure. He said he will not even be up to half.
He said we are spending half. Those were his words. We are spending half. I have the sound here. Would you like me to play it?
Let's finish with the contract documents and all that, and then now we are under emergency and we have to find a way of resolving the problem.
All right. The minister also said that the new contract will be built on the existing infrastructure. So that means the existing infrastructure that Lightwave provided. Is that correct?
Yes. The infrastructure Ghanaians paid for.
Yes.
Yes.
Which means that we are paying only for software.
Currently, we are paying for only software.
Now, the Lightwave contract, when you look through it and the breakdown of the costs, their software or the license for their software cost about $26 million. The rest of the cost was hardware. So if their software costs $26 million and the new one is costing $50 million, isn't it more expensive?
You see, if you look at this whole contract and then you want to deduct or take out the software cost from it, you won't get it right. We have said a lot of things. We have said that servers have issues. There are a lot of issues we have also put out there regarding how this whole project was run. If you only take it and you are running this under emergency, what we are even bringing, the current system has more function than even what we have.
Okay.
This is going to have more, in terms of its operation, it's going to be an exchange, a national exchange, where every other server will be connected to. So it is not like what you saw earlier. It's not like Lightwave. The current system is different from what we saw.
Okay. Please stay with us. I want to bring in Kwame Sarpong Asiedu. He's been very patient. I think Kwame is trying to catch a flight. Kwame, good morning.
Good morning, Kojo. How are you?
Very well, thank you. And thanks for your patience. This is a mess. How do we fix it?
Kojo, you see, it is a mess because, and I'm not going to hold any punches, we in this country create monopolies that come to bite us. The sad thing is when these monopolies are being created, the beneficiaries of the monopoly don't see anything wrong with it. So when in 2021, the then health minister wrote that only Lightwave will be recognized as an IT provider for all our hospitals, some of us raised hell and fire. I'm quite sure you've seen what Bryce Simmons has written. I'm quite sure you remember conversations I had with you and some of your colleagues back then.
Yeah.
Lightwave saw nothing wrong with it. And then they created, this monopoly, which was wrong because monopolies, by definition, do not foster innovation. They also stifle competition, and by so, generally they are more expensive because competition drives down cost to the state. So, from that point, even the 100 million, I have questions with the contract being that much because perhaps it would have been lower if there was competition. But Lightwave saw nothing wrong with it. They took it all. Then fast forward, their contract was supposed to expire in 2022, and then they had a 2-year extension to 2024. That contract was what we call a build, operate, and transfer. So the hardware you are talking about and asking the other person on, on the program with me, it's not owned by Lightwave now because they were supposed to have transferred that to the state at the end of the contract. So don't let us confuse it. That is our infrastructure. So I get a bit edgy when it's referred to as Lightwave infrastructure. So the minister is absolutely right if he says it's like getting a contractor to build us a road from Accra to Kumasi. The state pays for it, and you are calling it the Kwame Contractor Road. It can't be right. You need a contractor to build that road. He operates it for a while, and he transfers it to you at the end of it. The minute he transfers it, it's your infrastructure. Full stop. Secondly, I look at this and I get very worried. The Lightwave contract expired on the 31st of December. As at the 31st of December, the current government was not in power. It was the NPP government that was in power for another 7 days. If they thought they had a contract extension, government is a continuum. There was still a Minister of Health. Why was that not dealt with? Right? But more importantly, Kojo, you can argue and jostle and change. The minister says they have done less than 50% of the work. They say they have done about 77% of the work. The bottom line is that is a breach of contract. You are giving contract to do 100%. So Lightwave, even in its own communication, accepts that they didn't meet the terms of the contract. On the plain face of it, because you have the contract, I have the contract. You see, we should stop making excuses for people who take contracts from the state, breach the contract, and then to start with, they get an advantage to get the contract. They then breach the contract, and then they come and cry wolf. Then you ask yourself, what happened when you were being faced? Was there something wrong there? Then let's fast forward. Now we are here. They are one problem I have with the approach the Ministry of Health has taken is that Lightwave operated from January when this government came in until September. There wasn't any contract in existence. But by allowing them to operate, by default, you were acknowledging that you were going to pay them because they don't work for free. So that, I believe, Lightwave should be paid for because they provided a service. But that should be negotiated because there was no contract in place. So Lightwave cannot unilaterally, in my view, raise an invoice and say the state owes them this, because how was that agreed? Based on what contract? You see, Kojo, we need to have these hardball conversations if we want to progress as a country. Finally, the middleware, which is supposed to be the property of the state. I have never in my life, looking at health IT systems, seen any country where it is built and owned by a data processor, because essentially by our law, Lightwave are just a data processor. The data controllers and the data owners are the hospital, the state. Now let's look at this finally, because I'm trying to unpick it, and then I'll ask you where we go from here. Kojo, Lightwave say that the data sits with the Ministry of Health on the first floor. The Ministry of Health say they cannot access it. Kojo, two people have gone into a contract. You say you've given me something. I say I cannot access it. How difficult is it to sit down and say, okay, this is how to access it? The truth of the matter, for me, looking at it with an independent eye from a civil society standpoint, is this. Lightwave was supposed to do a build, operate, and transfer. And they were supposed to train people. And I've listened to the Lightwave interviews. They were supposed to train people so that when the transfer happens, these people can manage it on behalf of the state. I was on AM show with the Lightwave representative, and I told him this about the people. I know what they've done. They have failed to train these people properly so they can take over. And this happens globally. Build, operate, and transfer contractors tend to do that so that they can forever put you at a disadvantage so you cannot operate it. It happened with NHS Digital in the UK. And the UK lost a lot of money. So this is not the first time some of us are seeing things like that. It is a clear book that some of these companies use. And that is why, for those of us who know this playbook, we said from the start, there should never be a monopoly. Because once you get into a monopoly, this playbook happens. And so for me, I'm not here to cry for Lightwave. I'm sorry. I'm not here. They are part of the problem we find ourselves in. In fact, they are a big part of the problem we find ourselves in. If you ask me now how we get from here, the state needs to own the middleware because that is our law. The state needs to get access to the data because it's national security data. And that's the other thing I would want to conclude on. This whole audit, I don't know the firm who did it. I don't know, but let's get it clear. The state, as the data owner, has every right to audit from the, the data subject, which is the patient who goes to the hospital, through the data controller, which is the hospital, through the processor to the national data, because it is their data and they have to know the robustness of it and how it's being collected, and if it's being collected in compliance with our data protection regulation. If you see, the data commissioner has written a letter through the communications ministry trying to say that may have been breaches of our data protection law. These are why these audits happen. And finally, when such audits are happening, they do not tell the data processor, because if you are investigating someone who probably could be subject of a crime, you go informing them. Look, let's stop having these easy conversations. It doesn't help anybody. So the truth of the matter is, I cried not because an audit happened. If the audit wasn't done properly, because there's been impersonation of Lightwave, then yes, I have a problem. But the audit for me is in our interest because we have to make sure that that contract has been carried out properly. How the breach of contract happened and Lightwave couldn't finish it. It is in our interest as Ghanaians citizens. So nobody should create the impression that that is wrong.
Yeah, Tony Goodman has just told us that actually they had wanted to communicate the report, the audit report, to Lightwave, but were unable to since from January all the way up. Well, I don't know when the audit was done, but throughout this year they have been unable to submit the audit report to Lightwave. Does that sound regular?
Kojo, like I said, the audit report is not what I was subject to. The audit itself, the audit report comes at the end of the audit. I'm saying that while the audit is going on, you don't need, if you are the state who's the owner of the data, who's having data processed on your behalf, you don't need to inform the data processor.
Right. Okay.
There might be many reasons why maybe you may want to communicate or not communicate a report. Even me, if a report like that came to me and I saw that there might be a crime committed, I wouldn't give it to the data processor. I'll give it to the security agency for them to see if a crime may have been committed. It is their duty to then invite the person if they are potentially, subject to the investigation. But so that is why I say I don't see the argument like they are making that they were not informed that an audit was going on, because that would have been bizarre if the Ministry of Health had done.
Can you stay with us a bit while I talk to Tony, or do you have to go? I don't know.
No. I can stay with you a bit. If my flight is going, I'll let you.
Thank you, Kwame. Tony, let me bring you back in, and let's see if we can clarify a few details. Okay, you've sort of doubled down on the position that the 450 hospitals constitute less than half of the project. Can you tell us the remaining 500? What type of hospitals are they? Are they healthcare centers? Are there teaching hospitals in there, or district or regional hospitals?
Yeah,
what
mix
is left?
Of all of them. Mix of all of them.
So there's a teaching hospital remaining out of the 500.
Yes,
Which
the
one?
Regional, the health centers, SIPS compound, polyclinic.
Okay, tell me about the teaching hospitals that are remaining that have not been connected.
I think Sunyani, still they've not finished Sunyani. They've not finished. There is another facility, the teaching hospital, out of the 6. I kind of have the data here. And then most of the health centers in Eastern region where they say they have connected are not connected as we speak. We have some polyclinics across the country, health centers across the country, some district hospitals that are currently not on it.
Okay. Now, you've heard Kwame Sarpong Asiedu talk about how, the contract itself was faulty from the beginning. The fact that there was a monopoly, this idea that, and Lightwave insists that the contract was only for license to use the software, not for the ownership of the software. That's what Lightwave says. You say the contract was for the ownership of the software. Of course, we have the contract, so we will verify from reading it. But I have to ask you this. While this contract was being run from 2021 or whenever the whenever it was signed,
2019,
Kwame Sarpong was the ranking member in Parliament, and they had oversight over the activities of the ministry. They certainly knew about a contract of this magnitude, $100 million, to connect all the hospitals. How come, as ranking member, Sarpong never raised any of these issues?
I won't be able to say what happened when he was a ranking member, but I can say, I know how this thing works. If it's not a contract that is supposed to go through Parliament, then I'm not sure Parliament would want to know. And if also there is no issue regarding the implementation, if they've not come out, there is no public interest question regarding the contract. Mostly, you don't hear Parliament coming in there to question, because select committees are not supposed to run the ministries for the minister.
Forgive me.
There is a minister responsible for the sector.
I understand this, but this is a $100 million contract to connect all hospitals. They
didn't go to Parliament.
I know this, but are you saying that Parliament wouldn't want to know? We have testimony from Lightwave that Mr. Sarpong on at least 2 occasions was involved in oversight meetings planning the budget for the year regarding this project, which obviously was paid for from the nation's budget. You say Parliament wouldn't want to know?
That is what I'm saying, that what happened in Parliament I may not be able to know, but I know how this thing works. Ministers take full responsibility over their sector. Parliament will advise. Parliament will come in if there is a problem, if they have any reason to come in to question your dealings. But otherwise, it's fully a responsibility of a minister to run a sector and run it well.
So since we didn't hear from them during that time, it means they had no reason to question the contract.
Yes, but if you come to the seat, sit in that chair, and realize that you didn't see this, and you want to do something right or you want to actually direct the vehicle. But because you are a ranking member, you will say that, okay, let's continue with it. No. I believe that we should rather be, if I say, we should rather applaud the minister for even being bold, regardless of his relation with anybody, regardless his position in the past. And has found out that Ghanaians are not getting the benefits from this contract and has decided to redirect the whole thing. I'm sure we should not be too worried. What we Ghanaians are benefiting, his fidelity is to the people of this country.
Right.
And we cannot see, like said by Senior Kwame, the contract implementation had issues. Throughout, we slept on our right throughout the implementation of the project. And then we've gotten to a place that somebody must call the brakes, pull the brakes and said it's enough. Let's re-look at this whole arrangement and see if Ghanaians will benefit from it. So I think that is what the Honorable Minister has done.
What do you say to those who suggest that the minister is simply muscling out one contractor to bring in another of his preference for $50 million?
That is blatant lie, and is just to throw dust into the eyes of Ghanaians and to also let this whole matter look as though it's not important. It's an important issue. It's an important issue. The minister is not interested in any contractor. He's not interested in any money. I can say for sure, when this whole thing started, Lightwave has been invited severally. There's a lot of correspondence. And then what actually brought this whole thing, they know. So they know that it's not about money, it's not about any favoritism, any nepotism, or any bribery issue. But it's just the interest of the people that is so high.
Has the minister got PPA approval for this new contract?
Yes, we're going through a sole sourcing process to get this, because where this is being treated as an emergency. People go to hospital, they don't receive health insurance, their health insurance claims are down, the hospitals are down. Don't forget, it's not only the OPD and inpatient that is run on LHIMS. Even procurement and supply is run on LHIMS. MoH is run on LHIMS. The whole hospital is run on LHIMS. So if you have this system down, it means the whole hospital is down.
Right.
So yes, currently we are going through an emergency to procure this to help the people of this country.
Tony, finally, before you leave us, you were spokesperson for the health ministry back in 2016 when the phase 1 of this Lightwave contract was signed between the government of Ghana and Lightwave United States. That was that was a contract that should have gone to Parliament for approval, wasn't it?
Yes, in 2010, when we started this e-health strategic policy, there were a few institutions actually interested in this hospital management. Thankfully, in 2016, we were able to get Lightwave to actually pilot the product, because we had done the telemedicine in some part of the country, northern and I think Bongahafu. And then the next thing we wanted to do was to run the hospitals on a software. Lightwave came in, okay, let's do the pilot and see if it's possible. So after the pilot, what was important was to open it up for others. Because at that time, we had a lot of people coming into the space to actually do this. So I'm sure initially, because we didn't have enough companies and it wasn't something that most companies were interested in, we piloted it.
So that's why you didn't take it to Parliament?
No, it was just a pilot. You don't need, it's not every contract you need to go through Parliament. This contract doesn't need to go through Parliament. The one signed in 2019 doesn't also need to go to Parliament.
Even though it was with a foreign company?
It's not a foreign company, it's a Ghanaian-based company. It's a Ghanaian company.
It's a company incorporated in the United States.
No, Lightwave is a Ghanaian company.
The one that signed the contract in 2017 is a Ghanaian company, but the one that the government signed with for the pilot was a United States company.
I know Lightwave is a Ghanaian company, the one that was actually doing this whole work. The CEO is a Ghanaian. Everybody in Lightwave is a Ghanaian. The company is a Ghanaian company.
All right, Tony, thank you
Yes.
for your time with
I'm
us this
grateful.
morning.
I'm grateful.
Kwame, we're going to have to let you go. We appreciate your time. I think we have to move on to the next thing, but we thank you so much for your guidance there. That was Kwame Sarpong Asiedu and Tony Goodman speaking on the back of our interview with Lightwave. And I wonder